Hey there, medical professionals. Today I'm diving into a fascinating yet delicate procedure, the mechanical removal of maggots from the mouth, or oral myiasis. First off, preparation is crucial. The patient is comfortably positioned, usually reclining, to give easy access to the oral cavity. Sometimes mild sedation or local anesthesia is used to reduce discomfort and minimize movement. All instruments, like forceps, tweezers, and suction devices, must be thoroughly sterilized. The oral cavity is also cleaned with antiseptic solutions to reduce the risk of secondary infection. Next, visualization and access are key. Adequate lighting is essential, so a headlamp or specialized dental light is often used to focus directly into the oral cavity. Dentists or surgeons may also use magnifying loupes or a surgical microscope to enhance visibility and ensure precise removal. Now onto the main event: mechanical extraction. Fine, pointed forceps or tweezers are the primary tools here. These instruments are used to carefully grasp individual maggots. It's important to be gentle to avoid breaking the maggots, as leaving parts behind can lead to further infection or complications. Sometimes, a gentle suction device is used alongside the forceps to help remove smaller maggots or to keep the area clear of saliva and debris during the procedure. The practitioner methodically removes the maggots one by one. This process is slow and meticulous, especially if the maggots are deeply embedded or hiding in tissue crevices. Once the initial removal is done, it's time for flushing. The oral cavity is often irrigated with a sterile saline solution or an antiseptic wash. This helps to flush out any remaining maggots or debris and serves to clean the wound, reducing the risk of infection. The area is then carefully re-examined using magnification to ensure that no maggots or larvae remain. Further mechanical extraction may be necessary if additional maggots are found. Post-removal care is just as important. An antiseptic solution or ointment may be applied to the affected area to prevent infection and promote healing. The practitioner will monitor for any minor bleeding and apply pressure or other hemostatic measures if needed. Follow-up procedures are essential to ensure proper healing. Instructions are given to the patient for maintaining oral hygiene and caring for the wound site at home. This might include rinsing with antiseptic mouthwash or applying prescribed ointments. Follow-up appointments are crucial to ensure that the wound is healing properly and that no maggots have reinfested the area. Additional treatments, such as systemic antibiotics or anti-parasitic medications, may be prescribed based on the severity of the case. Handling of removed maggots is also part of the process. The maggots are often collected for